Hey everyone, my name is Sienna Boyd. I am the community rep at Rancho Family Medical, and we are in the Choose Health studio with Hillary Avera, who is one of our APPs at our pediatric office. Today we're going to touch on the flu and cold season. It is right around the corner, and we just want to answer some frequently asked questions about how to best prepare and best treat the cold and flu. So I know it's right around the corner. Why is cold and flu season typically in the winter time?
So really great question. Actually, a lot of people think that.
I think that.
Yeah, and they say, oh, the cold causes the flu, right?
Yeah. Naturally.
It is a contributing factor to the flu. So actually the word influenza, it originated in Florence, Italy, and it actually translates over to the word influence. So the cold does influence the increased numbers of influenza during the winter months.
Okay.
A lot of people ask the question, and there's a lot of different theories as to why there's increased numbers during those winter months, but scientifically speaking, the influenza virus itself, which causes the flu, actually survives a lot better in cold environments, so lower temperatures and less humidity. So for us, even in Southern California, when we have that dry, cold air, that's going to be when we're most susceptible to coming in contact and possibly contracting influenza.
Interesting. Okay, so cold and flu season is coming. I know for me, I can oftentimes get them confused. Do I have a cold? Do I have the flu? I know I can call, when I have the flu, I say, oh, it's just a cold, and then I give it to someone else. And so can you tell us the difference between the cold and the flu and how you can tell the difference?
Yes, that's a great question that many of our patients have as well when they come to see us in office. So one of the biggest differences is first, as far as a cold goes, it technically can be caused by hundreds of different viruses.
Oh, okay.
The flu, though, is typically caused by influenza A or influenza B.
Okay.
There is an influenza C that can affect some pediatric patients, but typically we'll see influenza A and B.
Okay.
And then as far as the symptoms go, a lot of times our patients that experience a cold, pediatric patients will have nasal congestion or even a runny nose.
Okay.
They may have a cough and they may feel a little bit fatigued. When it comes to patients actually having influenza, one of the stark differences is that typically in the history that we're obtaining, they say, I was fine, I was doing great, I had good energy, and all of a sudden I experienced, a fever that came on.
Okay.
And they may have those same things like a cough or upper respiratory congestion, but in addition to that, influenza typically can cause more systemic symptoms as well, like body aches, chills.
Definitely. Okay.
And they could have, worse fatigue with influenza than what they might experience with a cold.
Okay, that all makes sense. I've experienced both, and now that you have told me that, I've definitely had those moments where I'm fine at work, and then I get home and crash. It just hits me like a bus. So one of the questions that I've wanted to know are, what are some of the best practices to, one, make sure that we don't get the flu or cold, and then two, to ensure that we don't spread that to our loved ones or people around us?
That's a great question, especially with everything else going on right now in public health. So you definitely want to try to protect yourself as much as possible this year, every year, but especially this year. So we actually recommend the flu vaccine for patients as young as 6 months.
Oh, wow, okay.
That's the youngest they can be to get the flu vaccine.
Okay.
So ideally, schedule a nurse visit with your provider and come in and get that flu shot. Typically, we administer the flu shots at our office late August or early September, so it's a great time to go get that injection and then start building your immunity. Other things besides the vaccine is, of course, great hand hygiene.
Awesome.
So washing your hands, washing your child's hands, sanitizing frequently is definitely recommended.
Okay.
Having your child practice coughing or sneezing into their elbow is another way to reduce the spread. Wiping down surfaces that are frequently touched, as those can cause the spread of influenza as well. And then just trying to stay isolated. If you know someone is sick or symptomatic, then try to stay away from them, even if they are a family member, and remember to isolate yourself if you do become ill.
Okay, those are great suggestions. I love that. I know for me, oftentimes I have the flu and I don't want to be dramatic. I won't visit the doctor, and I don't know the best practice of when to actually go see a care professional if I'm feeling ill with the flu. What do you think are best practices for that?
So if you think that your child has symptoms that are consistent with the flu, I know a lot of parents that are like, I want to kind of use the wait and see approach, which can be appropriate. Oftentimes the cold and the flu in children can be self-limiting and self-resolving. Okay. However, if your child has risk factors such as underlying lung disease, cystic fibrosis, or asthma, it is crucial that we evaluate that patient earlier on. Also, if your child is under 5, especially under 2, they are at an increased rate for mortality associated with influenza as well as hospitalization. If we're going to treat especially our patients under 2 years old that test positive for influenza, ideally we will do a swab to see if they are indeed infected with influenza and prescribe them an antiviral such as Tamiflu. Viral shedding with influenza is typically highest at 24 to 48 hours of illness. Okay. So it's best to get the best result that we test them within that time frame.
Oh, okay.
And then just staying hydrated and resting as much as possible if they are infected is also great to do with your child after they've been evaluated.
Okay, that is super helpful. I guess in the same vein, how would you know when to keep your child home from school? You know, you don't want to infect others, but also you want your child in school. So what would be the best practice there?
So definitely getting tested if you think it is influenza would be the first step there. And then as long as your child is symptomatic, we do recommend that you stay home with the child or another adult stay home with the child. We don't want them infecting other adults, elderly, family members, or anything like that. But also we want them to rest. We want them to make sure that the patient's getting hydrated very well, that there's fever control. There are a lot of secondary bacterial infections that are commonly associated with influenza.
Oh, okay.
So sometimes, especially if they had a fever, it resolved and the fever comes back, then you do want to get your child evaluated and should be staying home with your child because they may have a secondary bacterial infection as far as like a sinusitis, pneumonia even, or they could have a middle ear infection.
Okay, that's a great suggestion. So you keep your child home, you make sure that when they're asymptomatic, that they're still, or when they are symptomatic, they're at home. And then you can send them back to school when they're asymptomatic, when they're no longer having symptoms. Is that correct?
Yes, and I should add to that too that they need to be fever-free for at least 24 hours prior to going back to school or daycare.
Okay, that's kind of what I wanted to know. I think that's a pretty across-the-board regulation for schools, correct? Yes. Okay, awesome. Well, thank you so much. Is there anything else that you'd like to add about flus or just about how to prevent them?
Just doing a lot of the things that we're doing now, practicing good hand hygiene, social distancing, and masks may even help with the spread of influenza.
Very cool. I love that. Well, thank you so much for being here again, Hillary Avera. We're so appreciative to have you here.
Thank you. Thanks for having me.